Hey everybody, this is Matt Shu from Upright Health. Today I wanted to share an email with you from Rodrigo in Argentina. Rodrigo got a diagnosis of femoroacetabular impingement, but his story is really important to share, and he agreed to let me share it because it's so illustrative of some of the problems that I mentioned in the previous video where I talked about problems with the FAI diagnosis. If you haven't seen that video, I do recommend you check that out. We kind of go through the whole step-by-step process by which people are told they have this problem. And Rodrigo is actually a version of the story that is really sobering and a little bit troubling, but that you should definitely pay attention to. So basically, Rodrigo was diagnosed with FAI a few months ago. He's been a CrossFit athlete, doing CrossFit 4 times a week, and he started to feel pain below his left knee. He had had a meniscus tear on that leg in the past, so he went to a doctor to check it out. The doctor said, well, your knee was fine. And then he started testing his hip. And he found there was a little lack of mobility that Rodrigo says he's always had. And so they sent him to do some x-rays on his hip to see what was going on. The results came back, and the doctor said, you've got cam and pincer deformities, and you should get surgery in order to avoid full hip replacement in less than 10 years. So Rodrigo was shocked. He was told to stop playing soccer and doing CrossFit or lifting weights and just get the surgery as soon as he was ready. So implicit in all this is you have these bone malformations. They are going to lead you to necessarily need a hip replacement in 10 years, right? These bone formations are going to doom you to having a poor functioning hip. Now, in many other studies, recent studies that I've talked about in other videos, that's just not the case, but that is what he was being told. And so Rodrigo points out the important thing to notice is I don't feel pain in my hip, even doing CrossFit 4 times a week. Why should I get surgery without pain? I went to a second doctor and they told me the same, get surgery. He even did the impingement tests on me, and I've never felt pain. So this actually goes back to that video I mentioned about the diagnostic process, right? The range of motion tests, even if you pass them and don't feel pain, if you have the x-ray that shows impingement, a lot of times you'll just get told you need to get the surgery based on the x-ray alone. But again, that doesn't seem to really make that much sense. So I wanted to share Rodrigo's story because it is so illustrative of some of the problems here. Basically, you can be told, hey, you've got the bone shapes and the bone shapes are going to destroy your hip, when all recent studies show that that's not the case. And basically, Rodrigo is being told you should get this surgery even though your hip isn't even the hip is not causing you any problems. You have a little bit of knee pain under your left knee. You have only a moderately impacted range of motion in your hip, but because you have the bone formations, get it fixed, quote unquote. So I hope this provides some insight into sort of the biases that play in here and some of the processes that are in play for a lot of people. Doctors are definitely well-meaning, but the older information, the older data, and the older beliefs around hip impingement still exist. They are now much more widespread than they were even 10 years ago. But now all the research is showing that those beliefs were really not based on solid data. So it's important to recognize that there's a lag between the data and actual practice. And it's important for you as an individual, if you're dealing with something like this, to really take the reins, really take responsibility, do the research for yourself, and kind of think through some of this yourself and see where it leads you. So if you haven't seen the video on the diagnostic process, I definitely suggest you check it out. We're going to link it right here. We'll just put a little box here for you to check out. See where all those weaknesses are in the diagnostic process, and think about Rodrigo's story, and hopefully you'll see things from a little bit of a different, more healthy, proactive perspective. If you like this content, please remember to subscribe to the Upright Health YouTube channel, and please remember that pain sucks. Life shouldn't.